Thank you all, and thanks to the Atlantic for hosting this event. We are pleased to underwrite this today, and it gives me my opportunity to shamelessly shill to you all. What I'd like to talk to you today about is a new report we have out just this morning on super spenders. And we define super spenders as those patients that are actually spending over $50,000 per year. We previously put out this report 2 years ago, and now we can compare over the last 2 years what has happened to this population. In the last 2 years, we now have 0.3% of the U.S. population takes pharmaceutical products that cost $50,000. That's 870,000 people that now that have bills of over $50,000 a year for pharmaceutical products. So when you think about it, if you look around this room, you actually know, every single one of you knows one of these people that actually takes more than $50,000 worth of drugs. And why is this? It's partly because of the success of the pharmaceutical industry. We are the most innovative country in the world when it comes to drugs, and we are coming up with new therapies that are treating previously unmet medical needs. We have new oncology products for things like pulmonary artery hypertension, hereditary angioedema, diseases you've never even heard about, but often cost a huge amount of money. And so we have patients that are suffering under the bills of $50,000. And this is only going to get worse in the coming years as we have gene therapy. Because as we have more personalized medicine, it's going to shift even more drugs to be ultra expensive. And so the question is, what's happening overall? Well, it turns out that overall, the industry has actually rallied to do a good thing. 83% of you all, the vast majority of the country, spends less than $1,000 per year on their medications. And so by trying to keep the cost down for the majority of people, we're able to actually pay for these really expensive patients. Last year, drug spend for the United States went up 3.8%. For those of you who are taking just traditional oral solid drugs, diabetes, hypertension, high cholesterol drugs, your expense actually went down by 0.1%. For those of you on specialty medications, your expense went up 13.3%, and when you average that together, it's 3.8%. That is actually the lowest trend we've had in a long period of time, and I can tell you preliminary data that we now have after 3 quarters of this year is that drug trend for 2017 will actually be even lower than 2016. And so we're doing a good job rallying to the occasion of trying to keep everyone's drugs prices down, even though we have these super spenders that are incredibly expensive for all of us. If you think about the number of patients spending more than $1 million, 2 years ago, 1 in a million people spent more than $1 million on pharmaceuticals. This year, it's 2 in a million people have over $1 million of spend for pharmaceuticals. And then the final issue is what's happening at the patient level. It turns out that plan sponsors, and it doesn't matter if we're talking about Medicare, Medicaid, the exchanges, or commercial plans, the amount of the money that the patient is having to spend, with rare exceptions, is actually being well controlled. If you're on a commercial plan, 98% of your pharmacy spend is covered by your insurer. That means only 2% is coming out of pocket. The average person with bills over $50,000 spent about $2,100 in copay. If you're on the other end of the spectrum and you're at Medicaid, Medicaid picked up 99.9% of the expense. Now for these poor people, that 0.1% is still substantial, but the point is that the plan sponsors are trying to protect patients from the high cost of these medications. The final thing is, what do we got to do going forward? The biggest thing we can do policy-wise is we have to have a biosimilars market that is vigorous in the United States. If you look at what biosimilars can do for the United States, biosimilars actually could save the country over $250 billion over the next 10 years. And that pays for a lot of this personalized health care. It pays for a lot of these super spenders. So we need vigorous biosimilar policy, both from the legislation, but more importantly from the FDA. So there are certain regulations that they can have an important role in lowering the cost. I will tell you that our report is available to you all. It's at lab.express-scripts.com. I plead with you to go out and look at it. It has a tremendous amount of interesting information on this really sick population. But it's very important because it really goes with what you're hearing about today. It doesn't matter if you're a Democrat or a Republican. It doesn't matter if you're from the pharmaceutical industry or a consumer group. We have got to work across the aisle if we're going to have logical drug policy, and we're going to keep America the most innovative country when it comes to pharmaceuticals, but we're also going to be able to afford this because this is important not just to you, it's important to your family, your neighbors, and to all of us. So thank you all for being with us. We really appreciate you coming out today.